My name is Christine Perbin, and I've been with Dr. Paul as a patient for coming right up on 10 years. So I started with hormone therapy right around that 10-year mark, and truthfully started with Dr. Paul to really find optimal health, and that was the first thing I decided to start with. And just remember waking up probably about 2.5 weeks later after the first time, and just kind of felt like I was in my 30s, and a feeling that I hadn't obviously had for a while, and just kind of became a believer and just starting to really take care of myself. Recently, I've decided to try the plasma exchange, and I'm very fortunate that there's not a lot of things going on with my body, and I think I was just interested again just for really figuring out like the optimal health, and realized that some of the numbers I had in my blood were kind of a little bit toxic. So I tried it, and I'm going on, I think I'm doing my third tomorrow, in fact. Sounds funny, but I don't feel tremendously different, and I think it was in a great way a compliment, because I don't think there was a lot wrong. So I think, but I definitely had a lot more energy like the following week. After, the first day you're kind of, because it's so interesting, it is kind of a process, totally comfortable process, like it's not a big deal, but you don't know what you don't know. So the next day I was a little, kind of just a little different, and then by the day after that, just kind of really unloaded energy. It sounds crazy, you can only think about things in retrospect. Of course I would have loved to figure out much more, even early 30s, because I think that, women, obviously women's bodies change after you have babies, and stress and life and work and family, and it changes. And so I wish I had known, but I also feel so fortunate because I did figure it out. And I just have so many friends and people I talk to that don't do anything, and like I feel fantastic, and I know it's like the right thing for me. So I kind of wish everyone would do it more for themselves. So again, I do the therapy I think it's every quarter is kind of how it works out for me, and I won't stop.